From your experience, what are the most effective ways to embed safety culture across all levels in an organization?
One of the things that we started when we started Wokat Hospital, South Mumbai, was I told my team, I said, the one thing that I want is to have the certificate on the wall, the Joint Commission certificate, the NABHC. And I think that really kind of became a cult movement in the sense that, okay, let's do it. Our boss wants it. It's a good thing to have. The other thing which I've always believed is that if you're able to explain to the junior most nurse why she or he needs to check two identifiers, why they need to do it irrespective of the time of day, if you're able to explain the why behind the what and the how, people understand and do that.
How do you balance, the operational efficiency with patient-centric care, and how do you overcome any of the challenges that you have?
I think there are times when, as a CEO, also you need to put your foot down or at least accept people when they say you can't do this, it's patient unsafe. But at the same time, there are times when you have to see through, people who will come with hidden agenda and say, I want this drug only. And if you're able to prove that the pharmacotherapeutic effect is good enough with another drug, I think that's just the call you have to take. At the same time, the advantage the CEOs, who have a quality background have, they know what is happening at the grassroots level. They know what are the things that are really unsafe, and they themselves do not allow such things to manifest within the organization.
What's the most unusual place you have had a work-related idea that just popped into your mind?
When I was traveling Jet Airways to New York, and they were loading the food, and that's when I saw that their food cabins, because they have to go through security, their food trolleys had this numbered tie which was there. And that was the time when we were opening our own hospital in South Mumbai, the Wokat hospitals. And that's when I realized that why don't we have these numbered ties for our crash cards, so that we know that people have not used it and abused it like a sub store. But I think that's one of the most exciting places I probably remember, because I remember I started talking to this air hostess. I'm sure she felt I was kind of trying to get fresh with her. But the fact remained that I was just trying to understand why do they put these numbered ties. And then she was kind enough to show me the manifest and say, this is how it goes through customs, this is how it goes through security. And I said, hey, this is a fail-safe method. This absolutely epitomizes, we learn all of these things like poker yoke and stuff. But this is something where it was actually done. And that's something which we've managed to emulate.
Thank you, Dr. Parag, giving us an opportunity to record this session with you and understand a little bit more about you and about the different experiences that we can learn from those. Patient safety is a very critical component. Obviously, healthcare quality is a larger umbrella. Keeping all these things in mind, if before getting into some of the key and the specific questions, if I could ask you just one or two questions just for the fun's sake and just to get your understanding of those. If hospitals had a quality superhero, what powers would you think they should be having?
So first of all, Gaurav, thank you so much for having me over. I really appreciate this. I think if, well, quality superhero, I guess our clinicians and nurses are quality superheroes in many ways. But if they were to really be superheroes, I think one would be having the potential wisdom of post haste sight or post event sight. The second one is I wish we all had an eraser or a magic wand with which we could just erase errors away and say, abracadabra, you're off. And I think the most important thing is if the quality superhero could have a sense of empathy for the fact that other people are also trying to work in clinical medicine and they're also trying to do something for the patient. Apart from this, if our quality superheroes could just have resilience more than what is currently there today. I think today many quality superheroes tend to get into the chalta hai mode and they kind of take things for granted. And I think that's something which could really help. If we could have, like you have Harry Potter's, in Harry Potter, you have the hat which gives the names. If you could have the hat going around and actually sitting down on clinicians' heads and nursing heads and saying, hey, listen, this is the compliance hat and you guys are not complying. I think that's something that would really, really help. But I think the most important thing would be to constantly have a source of strength and energy so that we could continue along this journey of healthcare innovation and patient safety. I think that is something which is the most important thing for a quality superhero. It's a very interesting term, by the way. I'm even thinking, what would I name my quality superhero? Definitely not Superman, but and today one has to be pretty gender agnostic, so probably the word woman might have to come in somewhere. Yeah, but that's a nice question to start with. Thanks, Gaurav.
But really interesting answer as well, and that's always expected from you. What's the most unusual place you have had a work related idea that just popped into your mind?
Well, I won't say it was the restroom because it wasn't, though I've had some interesting calls in there, especially during COVID. I think the most exciting place I've had an idea was when I was traveling Jet Airways to New York, and that was the time when we had these non-stop flights or via Brussels or something like that, and they were loading the food, and that's when I saw that their food cabins, because they have to go through security, their food trolleys had this numbered tie which was there. And that was the time when we were opening our own hospital in South Mumbai, the Wockhardt hospitals. And that's when I realized that why don't we have these numbered ties for our crash cards, so that we know that people have not used it and abused it like a substore, and that when the next crash happens, you can actually correlate. And that's something that we've been using across the group. It's innovative. It's relatively cheap. It's just a rupee and 25 paisa, which is a rupee more than the routine tie. But I think that's one of the most exciting places I probably remember, because I remember I started talking to this air hostess, and I'm sure she felt I was kind of trying to get fresh with her. But the fact remained that I was just trying to understand why do they put these numbered ties. And then she was kind enough to show me the manifest and say, this is how it goes through customs, this is how it goes through security. And I said, hey, this is a fail-safe method. This absolutely epitomizes, we learn all of these things like poka yoke and stuff, but this is something where it was actually done, and that's something which we've managed to emulate. So fun place, yes. Jet Airways, interesting air hostess, good conversation, and I had a steady flow of champagne throughout the flight after that. So actually it was fun, Gaurav.
That's really again interesting. I think something similar keeps happening with me wherever I go, whatever I'm watching, even if I go for shopping, somehow that bent of mind, what's the thing that I can pick from here or learn from here, get it back to the hospital or do it as part of the process. I think that always keeps going on in our minds. But thank you for
Absolutely.
sharing
And
that.
that's why my mother-in-law stopped asking me to come over, because whenever I go, I'm looking for holes in the ceiling and loose wires and stuff. I mean, I guess the auditor's eye never really calms down.
No, I get it completely what you're saying. What are the key challenges hospitals face in balancing generally the operational efficiency with patient-centric care? Because now kind of you have been for a pretty long time in a role which is not only just quality or infection control, but it's also about managing P&L, hospitals, operational efficiencies. So how do you balance the operational efficiency with patient-centric care, and how do you overcome any of the challenges that you have?
So, to be very candid here, I've just got out of a meeting where we were discussing the cost of goods sold, and what is the price on certain drugs that we need to have, and so on and so forth, efficacy. At the same time, battling this whole challenge around antibiotic, resistance in the community, and the process of dealing with clinicians who don't want to agree to antibiotics, saving certain antibiotics as result. I think there are times when, as a CEO, also you need to put your foot down, or at least accept people when they say you can't do this. It's patient unsafe. But at the same time, there are times when you have to see through, people who will come with hidden agenda and say, "I want this drug only." And if you're able to prove that the pharmacotherapeutic effect is good enough with another drug, I think that's the call you have to take. At the same time, uh, the advantage the CEOs who have a quality background have, they know what is happening at the grassroots level. They know what are the things that are really unsafe, and they themselves do not allow such things to manifest within the organization. To that end, I think all our yours, mine, all our common training that we've had over the last 2 decades with NABH has really been useful. We've learned so much, with Joint Commission over all these years. We've been working with Joint Commission, you and I, way back from 2005. So I think all these learnings, our teachers in quality always used to say, if you get it in quality, you get it, otherwise you'll never get it. So it's like that. The balance between cost and effectiveness of the treatment that is rendered has to be quantified appropriately, because especially with certain rates coming in, insurance is pressing down, PMJY rates are pretty low in most areas. So I think here you need to take a conscious call, but at the same time you can't really put in a stent that's not going to work in the patient's body, right? You've got to have things which are appropriate, care that is absolutely on dot. Are there different spectrum, I mean, are there different drugs available within the spectrum where you can cater to all ranges of patients? There are. Whether we've had the time to study the efficacy of each of these drugs within the patient milieu, the patient cohort that we have, probably not. But I think only time will tell. The one thing I can tell you is that we've never kind of done this stinging on patients because he belongs to a particular class. If he needs it, he gets it. It's as simple as that. So that's where we are at. It's a tough struggle, but one that has to be done. So might as well take that with the patient safety always as a paramount sort of thing in our minds.
Completely agree with you on this. I think we are in a profession where cutting cost is not the right way or right thing to do, but then how do you improve your efficiencies, operations, your processes, your systems, so that wherever there is wastage, that is controlled? I think that is what we need to largely look at. And we do see that there are some organizations who do cut costs for the sake of saving money, but ultimately it does impact patient safety in some way or the other. And we really need to be very careful when we do that. From your experience, what are the most effective ways to embed safety culture across all levels in an organization?
I recently started seeing Grey's Anatomy again. Don't judge me for that, because I know there are different thoughts, schools of thoughts around whether one should see Grey's Anatomy and all. But what I liked about that is, this whole concept around walking the talk, this whole concept around, seeing one, doing one, teaching one. So I believe that people do see the culture when leaders sort of walk the talk. When they see that the leader is not interested in hand washing himself, or is okay with certain instructions for himself or his relatives when they're admitted in the hospital, people really take that seriously, and then they don't the culture doesn't set in. One of the things that we started when we started Wokat Hospital, South Mumbai, was I told my team, I said, the one thing that I want is to have the certificate on the wall, the Joint Commission certificate, the NABH certificate. And I think that really kind of became a cult movement, in the sense that, okay, let's do it. Our boss wants it. It's a good thing to have. The other thing which I've always believed is that if you're able to explain to the junior most nurse why she or he needs to check two identifiers, why they need to do it irrespective of the time of day, if you're able to explain the why behind the what and the how, people understand and do that. We did that, for example, when we were implementing the WAP bundle way back in 2005. We actually sat down with clinicians. We showed them articles. We showed them the CDC recommendations. We actually told them why we are doing it, and they all kind of said, yes, we agree. Similar thing we replicated when we were doing our medication safety sort of process review, annual review, which happens, as you know, every year. When we were doing that, and we came up with some suggestions, and everybody said, yes, it makes sense. For example, getting our nurse to wear a smock which says, I'm preparing medication, so that nobody disturbs her at that point in time. I think clinicians essentially are today seen and perceived to be anti-accreditation, because I think quality managers sometimes don't take the effort and the time to sit down with them and explain why we are doing what we are doing. Wherever we've seen that we've taken clinicians into the movement, we've always seen success. So that's something which I like to do: walk around, discuss with people, and I think the culture embeds itself.
And I think even I have kind of had similar experiences wherein if you actually tell the clinicians what is in it for them, for their patients,
Yeah, yeah.
not even for them per se, but for their patients, some way or the other, they definitely fall into, the requirements, and they definitely at least make an attempt and understand what we are doing. But yes, it just depends on how we are taking it through them and kind of, explaining them as to what we need from them.
Yeah,
So
I agree. They
that
are the
needs
ones who are the
uh,
most vested in the patient, right? I mean, we
that's
are
true.
also invested in the patient, but they are the ones who are closest to the patient.
Yeah, that's true. Agree. Uh, Now, talking about a little bit about digital innovations, we talk about AI, we talk about machine learning, we talk about data
Yeah.
analytics. How do you see all these things transforming quality assurance and largely safety processes in hospitals?
I think ab initio, the first thing that's going to we are going in for a new hospital information system ourselves, and one of the first things that's going to happen is the I mean, this may sound very mundane, but the whole automation of the documentation process, because most times people just shy away from documenting, not because they don't want to do it, but they're just too busy. I think that I'll break this up into two parts. One is on the quality piece and the administration piece. I think there's loads to learn from AI. There's going to be a lot of opportunities for improvement identified through artificial intelligence. The ability of AI and machine learning to be able to simplify processes for nurses. Nurses do a lot of repetitive processes. So the ability of AI and ML to reduce that or to infuse some smartness into that is something that's good. That's definitely going to help. What's also important is what we are excited about is this whole piece of AI in clinical medicine. If we already use some of this, I'm sure even Apollo did. We used a lot of this when we automated Gulati's and Gulati sims, and we got the drug interface embedded into our systems, and we sort of started using that. I think that was way back in 2013 we started using that. But I think today there's an opportunity to interface with investigations, to interface with clinical history, past history, family history. The ability for a clinician, for example, to not prescribe or to prescribe a nephrotoxic drug, and to be alerted by the system that, hey, this patient's creatinine is high, and would you like to rethink your decision? This is a safer drug which would have the same efficacy, the same bugs would get cured. I think that's a huge opportunity, because at the end of the day, to err is human. We learned that, what, 30 years ago, 40 years ago. So I think this is a huge opportunity. The good part is that thanks to the uptake of mobile telephony and digital technology in other areas like banking and ticketing and so on and so forth, today, and especially with doctors, the stock market as well, doctors really don't think twice about using it. And earlier, 15 years back, it was a struggle to get them to sit to the computer. Today it's BYOD. Get your own device, do what you want. We have firewalls, we'll take care of all of that. You just do your work safely. Plus, I think the attraction for this data to get transformed into a research paper automatically. These are all areas which excite me and which excite us at this organization. I'm sure they excite you as well. And I think that's something which is going to be a huge propeller for medicine in the future as well.
And it's very critical to also accept technology as an enabler rather than thinking that it's going to increase my work. How am I going to do it? Yes, initially, when you start using it, it may be a little challenging. But then once you get a hang of it, I think the kind of data that you get, the kind of analytics that you can create, to identify very focused zones where you need to push to improve further. I think all that is very relevant, especially when we talk of quality and patient safety, and it's definitely going to help a lot in going forward. A similar question as a next step to what we just discussed, if you're looking ahead now, what shifts do you foresee in India's approach to hospital quality patient safety over the next decade?
The first thing is that we are, already over the last 10 years, we've seen India, especially when Mr. Modi was chief minister, we've seen India take on the entire gamut of accreditation for even its PHCs, CHCs. One is that, just on the accreditation piece, and this is not quality management in toto, but I think that's one. I think the second thing is India, being the powerhouse that it now is. I think we need our own ARC. We need our own CDC. We need our own bodies of international repute. And I think that the ability of organizations, this is an excellent platform, the International Patient Safety Conference. And, we have CAHO and we have AHPI and NABH itself, though it's an accreditation body with Dr. Kochar there. I think there's a huge opportunity for us to collaborate and to create platforms wherein we would be comfortably sharing data, anonymized, legitimately put in there with due permissions. And I think it's time that we have our own subset of data so that our insurance companies are able to budget better. Overall, as a country, we're able to save money. We're able to leverage this knowledge and to show the world that we are also improving on healthcare quality. I mean, medical tourism is a huge business in itself. And one of the reasons why we're probably failing today is we're not able to showcase the excellent work that we do in the way that foreign countries are used to showcasing it. So I think if you're able to create these organizations of international repute in our country, which I know that it's only us like-minded people who will be able to sit down and put this all together. I think that's the opportunity that India can look forward to. That's the opportunity that India needs to grab. We can become a leader in the ASEAN countries and the SAARC countries. We know for a fact that our union ministries are pretty geared up towards supporting us on all of this, and I think that's where we should go.
And listening to you, I think you're the best person to lead this and kind of, you know,
No, no, no.
take develop it, take it forward
Well,
and
so
run it.
I'm happy to support any such initiative. Being a worker bee, I think there are enough queen bees, and most of you all reside in Delhi, and we are okay with that, and so that's fine. So
So, since you spoke about IPSC, what excites you most about International Patient Safety Conference 25, and how do you see it influencing the future of healthcare quality and patient safety?
so I guess this is the 12th IPSC, 11th,
12th.
12th. I've had the privilege of attending, I think 11. You invited me. You didn't invite me for one, by the way, Gaurav. That's your bad. I've had the privilege of
I
speaking at
miss.
10 or 11 of these. And I believe that I think one of the best things that happens at IPSC is the meeting of minds. I think one of the most fertile grounds where people meet is the faculty lounge, the ability to interact with peers, the ability to discuss what's happening in the world. I mean, when you have people like the squad chair and the Joint Commission chair and our own NABH and our QCI, Mr. Shah is going to be there, and this time you have the Prime Minister also coming. So that's always exciting. But I think what's most important is the ability to immerse oneself into pure academia without thinking of business. The ability to grasp what other people are doing and to take it home without having to think, hey, is somebody going to judge me for this? I think these are some of the things that we keep talking about. I remember the last IPSC and the wonderful debate that we had around touch versus tech, and we've actually come back and crafted a whole program around that is it just good enough to have tech in the room? Is touch relevant? So I think these are the things that for me, IPSC is always about getting my next moment of inspiration. It's about getting my booster shot of the innovation vaccine, if I may call it so. And for that, it's something that I always put store by. This time, unfortunately, I can't be there on both days, but I'm really looking forward to meet you at least on day one. So thank you very much for the invitation.
And thank you so much for your time, for motivating us with your kind words about the conference. And, we really look forward to having you, hosting you there, and, making sure that you are a part of this conference so that people and a lot of these delegates who are coming, they learn from your experiences and your
Sure.
insights. So thank you so much. Look forward to meeting you.
Sure.
Really appreciate your time. Thanks.
Thank you very much. Thank you.